We want to welcome you today to the Norman Fixel Studios at the University of Florida. And today we are just absolutely enthusiastic and excited to have a program with you. This is a Facebook Live. This is on Tourette syndrome in the COVID era. And we're going to be talking all about Tourette. We're going to be taking your questions online, which is going to be really cool, and we're going to really dig in, and hopefully this will be a fun hour, and we're certainly looking forward to everybody. And so thank you for having us. I do want to mention that that we do have a wonderful support network that's set up, and Tourette Association of America is one of the leading, if not the leading, advocates for Tourette globally, and partner with all the other organizations all over the world. But they do such a great job. And if you have questions or need support, you can email those in to support@tourette.org, support@tourette.org. And that is definitely a great resource to have. There's also a 1-800 number, and actually it's an 888 number, and it's 888-4-Tourette. And it kind of cuts off because you run out of numbers and letters. So it's 888-4-TOURET. So 888-4-TOURET. And we also have information for you up on the Tourette website at tourette.org/COVID. Tourette.org/COVID. We got a whole bunch of information that's there for you, and we are totally looking forward to spending the hour with you this morning, and we want to shout out to everybody and say, please write in with your questions. I see Janet Smith is already on this morning and is an adult with Tourette. So welcome, Janet. And we want people to come in and to ask questions. And I've served on the medical advisory board for the Tourette Association of America. They're a great organization and completely dedicated to helping people with Tourette, and also to moving toward cures and better treatments, and really moving the ball forward. And it takes time to get to these outcomes, but it's so important. But the thing that we want to focus on today isn't as much about the research with Tourette. It's a lot more about what can we be doing here during this COVID crisis. And so we really want to shout out to everybody, and to make sure that that you are available, and that you are thinking about questions that we can answer for you. And so Janet Smith's been our first person in this morning. We have this nice book that was written by our Center of Excellence groups. And so this is Tourette Syndrome: 10 Secrets to a Happier Life. I edited this book, but it is a book that has been available now on Amazon.com, and it is from our Tourette Center of Excellence network. And so we have dozens of these centers of excellence throughout the United States. And this was the group that was the Southeast Center of Excellence. So the University of Florida, Emory, University of South Carolina, University of Alabama, that whole group got together. University of Miami is part of that group, and came up with all of the 10 secrets. And the reason I'm showing this to you is a lot of the great tips are in here. And for the first 10 of you, I'm going to give you a free copy of the book. Okay. So the first 10 of you that ask a question online here, we're going to give a free copy of the book, and I'll ship those off to the Tourette Association of America today. So I want you to come on in and come into our Facebook Live and really get involved. So let's kick this off and have some fun. And so the first question that we have in this morning is, what is COVID-19, and where did it come from, and why should I care about it? Okay. And so I think this is a great question to start with. And COVID-19 is a coronavirus. It's a type of coronavirus. Okay. Now, when we talk about infections, we talk about things that are viruses, and we talk about bacteria. Okay. Viruses and bacteria. Okay. And so influenza or flu, okay, you all get your flu shots. Flu is a virus, okay? And so it's important that we're thinking about, okay, we've got viral causes and bacterial causes, and then there are pneumonias that people get, and some of those pneumonias are bacterial. Now, the reason I bring this up is that you can get a shot for flu, for influenza, a vaccine for influenza. Most of us get these vaccines for influenza, okay? And that is a virus. But you can also get a shot called the Pneumovax for pneumonias, and that is a bacteria, okay? The coronavirus, what is it? It's a virus, okay? So it's a viral cause, okay, that once it enters in the human, and we believe that the DNA from corona, we believe that that DNA came from a bat, actually. And bats are the only mammals that fly. So if you want to have a good a really good trivia session tonight at the dinner table, because now we're all stuck at home, so we got to eat dinner with each other and visit a lot. Here's a good trivia question for people to ask. The only mammal that flies, it's a bat. And we don't know exactly why, but bats' immune systems seem to be different, okay, than other animals. Perhaps it's because it's the only mammal that flies, and it seems to be toned down. So bats can actually carry things like rabies, and they actually carry quite a number of coronaviruses, not just the COVID-19 virus that we're seeing now. And then some of these bats can transmit to humans, either through wet markets or other things. And that's sort of how we see this come, okay? The experts in the world, and in looking at the DNA, okay, so that is the genetics behind the COVID virus, all of the best experts in the world do not believe that COVID-19 came from a laboratory, and that it was some act of terrorism, that somebody created this virus and put it out there. It probably was spread out inadvertently through bats, and some people actually eat bats. And it turns out that that's probably how this started. And so it's a virus, okay? It's not a bacteria. We have shots for influenza, and that's the vaccination. We have vaccinations for some bacteria called the Pneumovax, and we actually encourage a lot of people. So with other diseases like Parkinson's disease or neurodegenerative diseases, we encourage people to get flu shots and to get Pneumovax shots, and certainly very safe to get these in Tourette Syndrome as well, if you want to get those shots. And most people don't get the Pneumovax shots unless they're a little bit older, into their 60s, but it's fine to get it if you want to get it a little bit earlier. We don't have the shot or the vaccine yet, okay, for COVID. And so coming back to that first question, what is it? Now we know what it is. We know it's a virus. We actually don't have a treatment for it. We don't have a vaccine for it. So that means that prevention is super important. And so that's why we want you to focus on primary prevention, because it's going to take 12 to 18 months. At best, we might see the beginning of a vaccine by December or January at best, if we were totally lucky and all things lined up, but we'd still have to figure out how to make the number of doses to get it to all the people around the world, which is another issue. So it's a great question to start from. So thanks for sending us in questions, and so we're off here. And I remind you, first 10 of you with questions here, we're going to give you a free copy of the book here. We'll mail those to the Tourette Association of America, and we'll get your information from you, and be happy to mail you a book. So Janet Smith asks a question here: is there a connection, okay, between Tourette syndrome and autism, a connection between Tourette and autism? This is just an absolutely great question. Thank you for asking it. It is something that we need to directly address, okay? And the reason that we need to address this is there's been so much, news about autism and vaccinations, and people not wanting to get vaccinations, and vaccinations causing autism. And so the first thing that I want to say, and I want to be very clear on this, the papers and the data that have been submitted to major medical journals like Lancet, New England Journal, other places, the major medical journals and the experts from the major medical journals weighing in on this have told us definitively that there is no connection between autism and vaccinations, okay? And we don't believe there's a connection between Tourette and vaccination. So there isn't a reason not to get a vaccination because you think you're going to get Tourette or autism, okay? Now, to get a little bit deeper into your question, Janet, you want to know about connections between Tourette and autism. And it turns out that this is a very tricky area, okay? And the reason that it's very tricky is that we create a set of guidelines that diagnose somebody with Tourette syndrome. So you're below a certain age, 18 or 21, you're below a certain age, you've got changing tics over time, you've got motor tics, you've got vocal tics. And so we create these criteria, right? But children and adults with autism can have tics as well, often have tics, frequently have tics, okay? And frequently are below the age limit in Tourette, and frequently have motor and vocal tics, and frequently they change over time. And so we get into this confusion about where does Tourette stop and where does autism start, and how do we separate these two out if you can actually have the diagnostic criteria potentially for both co-occurring. And so we're still learning, Janet, and what we really need, and one of the big investments that the Tourette Association of America and others have been making is in genetics and imaging and understanding the biomarkers. And what we really need to do, okay, what we really need to do is we really need to focus on how we can better define this. And we're probably going to need markers like genetics and imaging and clinical markers, and put this together with large multi-country, not just multi-center, but multi-center, multi-country consortiums to sort this out. And so, super, super question, okay? So our next question is another good one, and it's about what are the current and latest CDC recommendations for people in terms of going out into public. And if I have Tourette, should I be worried about going out into public? Okay. And so this is a great question. And I would say that, that what we know right now, okay, what we know right now is that we should be socially isolating, okay, meaning that you should be 6 feet or more away from people, should be using a mask or some sort of facial covering if you're out in public. And that has changed over time, over the number of weeks that I've been broadcasting these types of coronavirus informational sessions on Facebook Live for Parkinson Foundation and for others, and the talks we've been given. We've been watching the evolution here. There is going to be a day, okay? There is going to be a day very soon, okay, where we are going to start to come out of our houses. We know that COVID-19 is primarily a respiratory spread bug. That means person to person, primarily respiratory. It means don't touch your mouth, okay? It means when you cough, don't touch your face, use your elbows and your arms. It means that staying within your house is a good thing. And we know that social isolating is helping, and we're flattening the number of cases, which has helped us to handle this in our hospital systems. We know that we should be taking deliveries of things and letting the delivery people leave the stuff at the door and then taking it inside, throwing the bags away, washing things off, and trying to prevent the spread. But primarily, it's person to person. And so one of the things that I want to update you on today is that as we begin to go out into public, as we begin to see some of the social isolation in a phased way across not only America, but we have people now writing us questions from all over the world. As you begin to go back out, a facial covering is going to be important, continuing to be vigilant, continuing to wash hands for 20 seconds or more. So that means when you wash your hands, sing the song Happy Birthday at least twice, so you know that you've washed your hands for 20 seconds, or count the 20, whichever you have. Maybe you have Tourette with a little OCD and you like counting. Here's a good way to do it. Wash your hands a lot and count, so the OCD will work for you if you have Tourette and OCD. but that is super important. And the latest CDC recommendations are to cover your face out in public. And this is going to change, okay, over time. And it's something that we should be really thinking about. So thank you so much, Janet, for the question about the link between Tourette and autism, and for our next question on the latest on CDC guidelines and where we are headed with Tourette. So Noelia, and I hope I said that right, Noelia writes in about people who have Tourette and whether or not this coronavirus is making the Tourette worse. Okay, is it making it go off? Are you starting to go and bang, like all of a sudden you're having a lot of worsening because of this this particular virus? And it turns out that Tourette belongs to a group of diseases that we call basal ganglia diseases. And I don't mean to bore you with big brain talk and brain speak on this broadcast, but what I do want to emphasize is that there are a group of structures in the brain that work together. They modulate things like movement. They modulate things like mood. They modulate things like thinking, okay? And they're sort of a filter, almost like a data processor, and they help us to sort out a lot of these important functions, okay, that we have. And when we are under stress, okay, with a disease that affects those structures, and Tourette is a disease that affects basal ganglia, it affects these structures that are sort of data processors in the brain. When we are under stress, when we have stress, anxiety, sleep deprivation, even without corona, it turns out that tremors get worse, tics in Tourette patients get worse, and movement disorders in general get worse. And also some of the what we call non-motor manifestations, depression, anxiety, sleep deprivation, they also get worse. And so the answer to your question is really interesting. And that is that coronavirus can make your Tourette go off, okay? Meaning it can worsen the Tourette syndrome for you. And so it's really, I think, super important to keep that in mind and to understand that any stress, anxiety, sleep deprivation can make this worse. The other thing that is making the Tourette initially better for some patients and now worse as this pandemic continues and as we go on day by day and week by week is that we know we have some data to suggest that a lot of persons with Tourette syndrome, when they go to work or they're in highly stressful situations, they actually do worse. And then when they come home, they come back within their home setting, they actually do better, okay, within their home setting. That's kind of what we see, not always, not 100%, but kind of what we see. The stress, anxiety, things tend to be worse outside your home. Now what we're seeing is a beginning of a reversal, okay, in some of our Tourette patients. Now you're stuck at home and it's becoming stressful to be at home. So now we're seeing something as clinicians and practitioners who deal with patients and try to help treat patients with Tourette. We're seeing something we haven't seen before, which is people with Tourette syndrome within the home setting actually worsening, okay, during that home setting. And so this is something that we are, super interested and we're super intrigued by this. But just because scientists, we get intrigued about what's happening within the home setting doesn't mean that this is good for you. This is bad for you. So we now realize that the social isolation for our Tourette patients is having a price, okay? You are paying a price, and the price is that you are worsening, okay, with some of your symptoms as you get more stressed out about being at home. And so the next question that we got is about social isolation. And so we're asked about how is social isolation affecting persons with Tourette syndrome? And the answer to that question is initially it was good because it got away from stress, anxiety, people, and other things. But now it is turning out to be driving a lot of the tic symptoms and making things worse. So what can you do? Well, certainly we want you to continue to socially distance, continue to stay away from people. But as this thing goes into its next phase, we want you to get a mask, cover your face, go out for walks at times when there aren't people around. Stay away from people, go out for walks, and try to find activities that you can do that will get you somewhat out of the house, but do it in a very safe and controlled way. And so a lot of our patients who are elderly, meaning 60 or more, who are in higher risk categories, not higher risk to get COVID, but higher risk if they get it for recovery. If you're in one of those older categories, or if you have diseases like hypertension, high blood pressure, diabetes, Parkinson's disease, Alzheimer's disease. So we're trying to keep those patients safe. But at some point, this cabin fever, which is better than corona fever, this cabin fever that people are developing from being inside, can also be detrimental. So figuring out things that you can do: exercise within the house, under desk cyclers. If you have exercise machines in the house, that can be great. Activities, walks, getting out of the house in a safe way. A drive in the car with the windows up can also be a way to help with the corona cabin fever that we're seeing. And so I would really say be safe, number one, but also be extraordinarily sensitive to the fact that this social isolation can have negative consequences, and we don't want it to have negative consequences for you. And so thank you so much, Noelia, for that question. It's super important that we address social isolation. So our next question comes in about what can you do to prevent coronavirus COVID-19 infection in Tourette syndrome? Great question. And I'm glad that you asked that question. Okay. It turns out that the prevention of COVID in Tourette or in any other disease is still in making sure that you limit your respiratory contact with other humans. That is the number one way to prevent this. There's not a drug. There's not a vaccine. Okay. It's your behavior. So you're in control of the situation. And so I want everybody to understand how important that is, and also how important this flattening of the curve has been. We haven't talked as much the last couple of weeks about flattening the curve, but that means that there's a peak number of cases that come in a disease like this, in a pandemic like this. And if all of those cases peak at the same time, they come in at the same time, we overwhelm our hospital systems. We overwhelm our personal protective gear, our PPG, that we need to protect you and to protect the people in the hospital. We diminish our capacity to take people into the hospital for other surgeries, elective surgeries, other things. And so by socially isolating, we're actually spreading that curve out and trying to push things down the road, decrease the number of cases, and keep the cases from spiking and overwhelming our hospital system. And we saw nearly overwhelming the hospital system, and in some cases overwhelming it in the New York zip codes. And certainly some of those hospitals got to the overwhelmed status. But for the most part, across the US, the social isolation has been working and it's been flattening the curve. So that's the number one thing. So whether you have Tourette or not, prevention. Okay, that's my message to you today. It's still prevention. Vaccine is still 12 to 18 months away. If we get lucky, we might start to see a vaccine by December or January. But even if we do see it, we got to figure out how to make the dosages and get it out to all these people. So we are still stuck in the next 6+ months for sure in prevention mode. Okay, so that's a great question about what we can do to prevent the spread of this. So thank you for the question. So Roberta Sims Penny, thank you for your question, for writing in. Thank you for doing this. It's my pleasure to be on with you and to help you in any way I can. What are my thoughts on neurofeedback to treat Tourette syndrome? You know, this is really interesting. And there was a paper, and I have a bit written about this on one of the blogs. So as an author, I have a website called ParkinsonSecrets.com and another one called TouretteTreatments.com. It's my author website for all of the 12 books that I've been involved with over the years. And on the Tourette one, the TouretteTreatment.com, there was a new study that I wrote about recently, and it wasn't done by me, but it was using imaging, so taking pictures of the brain and then using feedback, okay, and having patients be able to control the images that you see in real time with the feedback as a way to treat the Tourette. And so not only, Roberta, are there really promising things on the horizon for the neurofeedback, and part of neurofeedback is also simpler things like cognitive behavioral intervention therapy is a form of feedback. Now, of course, we don't have the image and other things that people can look at to learn how to do that feedback, but it's a form of feedback, a basic form of feedback. But now this neurofeedback that you're talking about, we're seeing more and more studies on this. It's really cool. I think it's got some legs, as they say, in sports or in academics, and I think we're going to be seeing more of that. So, Roberta, thank you for your question this morning. Really, really terrific. So the next question comes from Marla Shea. Welcome, Marla. Thank you for writing in. Marla wants to know what we would advise, or what advice would we give for individuals who are essential workers and wearing face masks, and their face masks are making their face tics worse. Wow, Marla, this is really really an important question. And so we know with Tourette that a lot of our kids and adults with motor tics and vocal tics, it affects from the neck up, right? And some people get facial twitching and facial movements and eye blinking and movements of their face. And by putting something over them, by touching that, in a minority of cases, it might actually improve the tics. And so people have done studies of various so-called sensory tricks or giving little bits of sensation to try to improve the tics. But for the most part, once things become irritating and also causing stress and anxiety, this can really worsen the tics for an individual person. So what can you do? If it's touching across there, at some point as this pandemic begins to decline and people are going out into public, if you are one of those people that a face mask that actually touching the skin is really causing worsening of your tics, you may be able to get one of these face shields made so that it doesn't have to touch your face. Face shields are things right now that we're reserving for the most part for our healthcare workers who are trying to stay safe when they're doing things like putting breathing tubes into patients, and the particles that people are breathing out could cause them to become infected with COVID. And so we're trying to send all of those face shields to our frontline workers. But as we get things under more control, people are actually printing these using 3D printers and cool things, and you're seeing more and more on the market. And so I would begin to look, and I think you're going to see a whole lot of protective gear out there, both because it's going to provide some economic opportunity for businesses, and for businesses are going to start to shift, to start to making things, making clothes, making scarves, making things that are going to go over the face. And also a scarf over the face may be better in public than if that may be more comfortable and could provide a modicum of protection, particularly if you continue to socially distance. And so that may be an option as well. It depends on how aggressive you want to get, but I would start looking at other alternatives. And so it's a great question and something we're super, super concerned about. So Basal writes to us from Turkey. It looks like this question is in Turkish, and although one of my books was translated to Turkish by a friend of mine who's now in Lund, I can't answer that question, so I'm going to ask Basal to write that back into our website, which is support@tourette.org, support@tourette.org. Any of the questions, too, that we don't get to today, please write in, and we'll translate that. We can use a translator, Basal, and get you the answer to your question. But thanks for writing in Turkish, and if you're in Istanbul or any of our favorite capitals, we really love to get the word out there. So thank you for writing in. So Maria Dobson-Slybeck writes in, are there studies that show that video games are worse for kids with Tourette? So Maria, thank you for the question this morning. It's not clear, and sometimes we're afraid to say we don't have the answer. Everybody wants to be smart and give the answer, but today we don't really have the answer. The number one answer about this, and it's really interesting. And in a lot of neurological diseases, we're actually finding out video games can be treatments. So let's take Parkinson's disease, dementias, people that have aging, elderly that have aging. And so we're beginning to use video games in that setting. And for some of our Tourette kids, when they play the video games, their tics actually go away as they're focusing on other things, or when they play chess, their tics go away. And for some, it gets worse. It might have something to do with a lot of the details in those games. We don't know for sure. And I'm guessing, since you're writing the question, that you may know a kid that's getting worse. And so one of the questions to ask would be to talk to your healthcare team, your occupational therapists, your physical therapists, your physicians, if you have a physician on that team that's working with you, your psychiatrist, your neurologist, and just describe to them what's going on, and see if it's something about the context of the specific games that are making things worse, if that's something that you're seeing. So thank you, Maria. Great question. We have another question here about, is it safe if I get COVID-19 and I have Tourette? So first of all, we want to make sure as many of you with Tourette don't get COVID-19. And the headquarters for the Tourette Association of America is in downtown New York City, right in the epicenter, of Tourette. So we're living this with you, side by side, and so just know that we know that many of you, particularly in the hotspots like New York, but in other areas, are going to get COVID. We want to help you through it. Use our support at Tourette.org helpline. Use our Tourette.org /COVID information that's up on the website. We first want to prevent you from getting COVID, but if you do get COVID, there are some myths that are out there. There's been this myth about ibuprofen, that if you take ibuprofen, it's going to make the COVID worse. We came out several weeks ago when this came out saying this was unlikely to be true. There hasn't been any data to support this. And what we do is we call this an association. So let's say people do bad, and maybe some people die of COVID or have bad outcomes. They go back, they look, and they see, what did they take? Well, a lot of people who are having fevers are going to take ibuprofen and non-steroidal drugs, and then you could make the leap of faith to say it was the non-steroidal that caused the worsening, but that actually may not be true. Now, the danger of the ibuprofen myth is that when your fevers are going high, it can be dangerous for you to keep a very high fever. So they do need to give you something to bring the fever down. So even if you still can't swallow taking the ibuprofen because of the myths, there are other things like Aleve, naproxen sodium, Tylenol, that you can take. And certainly Tylenol is in a completely different class, but this is a myth. Gurgling water, taking garlic, myth. Hydroxychloroquine has a lot of side effects. And so we came out talking about this right when it was hitting the airwaves. And we see actually something very interesting with hydroxychloroquine in Parkinson's disease and other diseases, other neurological diseases. When we do drug screens and we say what drugs are out there who are already approved might work against diseases, oftentimes anti-malarial drugs come up. And so those of us that have been around the block with clinical trials will tell you we not infrequently hear anti-malarial drugs as treatments for everything. Now, the anti-malarial drug hydroxychloroquine does go against the RNA, which is part ribonucleic acid, part of the whole circuitry of, you have DNA that makes RNA that makes proteins. And this might actually be useful for the type of virus, the coronavirus. So it's not totally, crazy, but there are a lot of adverse events. And a lot of times when we test hydroxychloroquine, it doesn't work and it just causes adverse events. So those of us that have been around the block say, whoa, be really careful with this. And now you're seeing the reports that are showing what we've seen in other diseases. So be super careful. That's another one. So we talked about the ibuprofen myth. We talked about the hydroxychloroquine myth. So thank you for that question. So Nate Richard writes in today, what causes Tourette and is there a cure? So Nate, thank you for that question. The answer is we do not know. Okay, we believe it's a neurodevelopmental disorder. So it's sort of something that's occurring over the development cycle, as the brain develops, and it's very common. I mean, almost everyone knows somebody with Tourette. We see it genetically in families. Even in people who think they don't have it in their families, that have one person with Tourette. If you ask them, do you have people that clear their throat in the family or sniff a lot? They'll say no. And then if you ask them again when they come back, they'll go, well, I thought about that question you asked me. And so it really does run in families. There's no cure. We are still looking at genetics. We're looking at environment. We're looking at a number of different studies. And the Tourette Association of America funds a lot of studies, looking at this. And so there's probably a lot of different causes of Tourette. And we say this about Parkinson, and we say this about other diseases, multiple sclerosis, other neurologic diseases, Alzheimer's disease, probably not one disease, okay? And so one of the things I want to stress to you is how difficult it is to come up with a cure when we have something that manifests tics and has, obsessive compulsive disorder symptoms and may have ADHD, meaning attention deficit hyperactivity features. So, one Tourette is one Tourette. And so we don't know that they're all the same. And so we don't have a cure right now for it, but we do have a lot of good treatments, both medicines and surgeries, like deep brain stimulation. And so thank you, Nate, for the question. We are hot on the trail, and we need to hurry up. And when people ask those questions, I always think my favorite picture is a picture of a man standing on top of a globe looking down at his watch. Because I always think about that when people ask those questions, or people come to my clinic and say, what's the new treatment? What's the new hope? What's going on? Do you have a cure? It matters for you all that have it. And so just know that it matters to us too. And we're really trying to work through it. So Johnny Davidson, hi from Scotland. Hey, Johnny, great to hear from you. My last trip to Scotland, absolutely. I absolutely loved it. Glasgow and all the other cities, just absolutely gorgeous. So thank you, Johnny, for tuning in. We have people coming from all over the world this morning to be with us, which is really great. Megan Kroll asks, what's the earliest age a person can be diagnosed with Tourette syndrome? So, Megan, it's a great question. And the first thing I'd like to point out is that the foundation always points out, and it's not because they want to nag people, that there's often a 5 or more year delay, sometimes 7 years, sometimes 10-year delay, sometimes even longer to making the diagnosis of Tourette. So people are, don't even understand what they have, and they're living with this, and it's affecting their lives in a negative way. And we don't get the diagnosis right. And there's this huge, what we call latent period before diagnosis. It's completely unacceptable. And it's something that the Tourette Association is really working to address. We do see across studies, people reporting, and we see patients, who are a couple of years old who begin to have tics. We mostly see people at the age of 5 to 7 begin to pick up OCD and tics and other things. And there's different curves that show when those things typically pick up. Those are medians and means, which means, you put everybody together and you get an average. But we do see people just a few years old who can begin to develop tics. And so it's pretty interesting. So Jessica Regal White sends me a heart, and thank you, Jessica. We're happy to be here with you today to answer your questions. And so moving down, Shabeli, and I hope I'm saying that right. Shabeli says, hello, my boy's 3 years old, hasn't been diagnosed yet, but I think he may have Tourette. He hits himself on the head consistently, smiles involuntarily, takes slow breaths, is very hyperactive. What the doctor recommends for me in this condition. So Shabeli, I really appreciate you writing in and being so straight forward. It looks like you're maybe in Minnesota. So welcome to the Midwest and Minnesota. So great to have somebody from the Midwest in the United States. There are some great centers there at the University of Minnesota. The Department of Neurology is chaired by Jerry Vitek, who's a wonderful guy who who sees Tourette patients, but there's also a whole bunch of people within that area and within that region. And so if you email our support at tourette.org, support, and then the @ tourette.org, Shabeli, we'll be able to tell you all the practitioners that we know and actually get you also to our closest center of excellence that is part of the Center of Excellence network. And so great question. So another question that's come in is, what about management of deep brain stimulation with COVID-19 and Tourette syndrome? So I have Tourette and have deep brain stimulation. Now I'm all worried because of COVID because I'm stuck at home. Fantastic question. So many fewer patients have had deep brain stimulation, which is inserting these wires into the brain to try to modulate different islands in the brain to improve the symptoms of Tourette, and mainly for the motor tics that are noticeable and the vocal tics, and much less for the OCD and other manifestations. The treatment is for people that have trouble with the motor tics, the vocal tics, and many of these patients also have self-injurious behavior where they might hit themselves or hurt themselves in a way that's involuntary. It's not being caused by them. They try all the medications, they try the CBIT and all of the other therapies. They might even have head snapping, okay, where they're snapping back. And with the head snapping, what's happening is that they might actually fracture their neck, and we've seen people become quadriplegic or paraplegic from this with Tourette. And so we have a treatment called deep brain stimulation that is useful for the less than 5% of people in Tourette that have no other options, and it's very good. It suppresses motor and vocal tics by 40% or more and can be life-changing and life-saving, at least morbidity-saving in people who may injure their spinal cord and have other effects. But when you're stuck at home and you have a device implanted, okay, you're worrying the battery is going to run out on that device. Who's going to program the device? How are we going to manage that? Super important questions. And recently, we actually wrote an article that came out just this week. And it came out in the Journal of Parkinson's Disease, but it's not just for Parkinson's. It addresses everybody who has deep brain stimulation. It's available free from the Journal of Parkinson's. If you type in Journal of Parkinson's Disease and DBS, deep brain stimulation recommendations during a pandemic, we go over this. What to do with your battery. You need to make sure that you contact your practitioner. Some of the things can be done by telephone, and some of the things in some locales in some countries like China, they can even program the device remotely. And we're going to be able to do that soon, probably within the next month or two, because COVID, the silver lining of COVID is we're getting more telemedicine and we're getting more access to people's homes. So you're inviting us into your homes. And so we can now help you to monitor that battery, help you to tell you what to do with the programming. We can even set programs so that you can program yourself at home if you're stuck. And then we tell you what to do if your battery lights are going off. And so there's some really nice information, and that's at parkinson.org/coronavirus, all one word, coronavirus, parkinson.org/coronavirus. We know you don't have Parkinson, but all the information that's on that page has to do with deep brain stimulation. We'll share this information with the Tourette Association of America as well, so that they can have links to this and the free downloads of management of these devices during a pandemic. Don't want you to worry. There's definitely a path forward for you in terms of managing. And so it's a great question on deep brain stimulation management. So we don't want you to feel alone. And also feel free to email us at support@tourette.org if we can be helpful. The last point is that on the Tourette website, you'll find, guess what? The Tourette Association of America funds the International Tourette Deep Brain Stimulation Registry and Database. So everybody, multi-country, that has Tourette DBS around the world, most of the cases get registered with Tourette, and they publish the articles on them. We try to help people as to what targets to go to. We help people with management tips. And so Tourette Association of America really leads on this, and all the data is publicly available on a website. It was published in the journal JAMA Neurology with a concurrent website to show they're completely open at the Tourette Association of America to make sure that you get access to this information. So thank you for that question on DBS. So David asks, I'm 45 with Tourette, love to share my story sometime. David, please write back in and to our support at Tourette.org, support@Tourette.org. That's our email address. We'd love to hear your story on Tourette and love to help you with any questions that you might have. Nate writes us back about agreeing. My wife's tics get worse, okay, when she's sick. And that's absolutely right. So remember, stress, anxiety, sleep deprivation all make Tourette symptoms worse and make tremors worse if you have tremor disorders and other things that are part of this brain network that helps to control movement, emotion, and thinking. And that network involves all three. So emotions and sleep deprivation, they can drive the tics. And so it makes sense that stress, anxiety, sleep deprivation, a pandemic, social isolation make a difference. Now, the next question is about telemedicine. And the Tourette patient wants to know, what about telemedicine for Tourette? Is this something that we're going to be seeing in the near future? Answer, yes. And actually, Tourette Association of America really led with this idea that we could provide cognitive behavioral intervention therapy using products like Zoom and other types of technologies to go into your house. And so we can go into your home and provide things, and it allows people who can't afford it or people who can't have access to it to have multiple trips to the doctor, to the occupational therapist, to the physical therapist, to the psychologist, to whoever is on your interdisciplinary team. This is awesome, okay? Totally awesome. But now the silver lining, okay, the silver lining of this COVID crisis, and Bastian Bloom, Ray Dorsey, and myself just wrote a piece that's out this week in JAMA Neurology on telemedicine and the future of neurological care with telemedicine. And we write in there that the silver lining of COVID is telemedicine. We've been fighting tooth and nail with Tourette Association of America, with Parkinson Foundation, with other diseases to, at least in the United States, allow telemedicine to be done nationally and internationally, but particularly nationally, and for our insurance carriers to pay for that and to incentivize us to use telemedicine. And it has been a long, bloody, difficult battle for the last 10 years. And then suddenly, within 10 days, okay, 10 years of work, within 10 days at my own center, I have all 55 neurologists up and going on telemedicine. It's awesome. And the payers, at least through COVID, are saying they're going to pay. We don't know if they will. We need to stay vigilant, everybody, and make sure that you're really charismatic, you're really aggressive, you agitate, and you make sure your legislators, you make sure TAA, everybody knows that we want telemedicine to stay. We have also discussed this on the medical advisory board at Tourette Association of America, because we've been engaged with telemedicine for so long. And in our discussions, it's been really cool because we're hearing things that we didn't hear before. Now that we can peer into the houses and see you in your home environment, we may see actually how many tics you have in your home environment, and you may be able to suppress those tics when you're seeing us. So it may look to practitioners like you're doing better than you are or worse than you are. And just our ability to peer in and interact with you in the home environment has been awesome. And I've really enjoyed this. And so I agree with Dr. Bloom and Dr. Dorsey, who also have a book out called Ending Parkinson's Disease in May. A really great book. And I agree with their assessment, and have joined them in that assessment, that the silver lining of COVID is the advent of telemedicine, and telemedicine for Tourette. And so I think that's super important. So thank you for the question. See a question about trying drugs and trying the retainer in the mouth, and seeing some, acutely but not long term. And so, we did fund some studies looking at this, and in general, just like hydroxychloroquine, ibuprofen, other things, when claims are made, it's up to the stakeholder organizations like the Tourette Association of America to jump on and see, is this true or not, and get the right information out to people. And so, Nate, I just want to tell you that a lot of people have told us that they got improvement with retainers or with putting sticks in their mouth and swabs to keep their mouth open. A lot of people said they got improvement acutely that didn't last. And so we've certainly seen that, and thank you for bringing that up. I think that's important, and I think the main point there is that we have to be vigilant about, if we tell you something, we got to show you the data, show you the money. Is it true? Is it not true? It's really, really important, and so I think it's a super important point. So Kim Salisbury writes, ticks are very suggestive, and seeing someone else's can also cause a person to do the same. And when I sent my daughter to camp for kids, all the parents were told that their child might come home with new ticks. So Kimberly, the suggestivity of ticks, okay, is one of the things in a patient, and I know this from being a clinician with many kids over many years and seeing kids and adults with ticks, that you can suggest, and the suggestibility also can drive certain ticks or even bring certain ticks out, and they can be suggested. It's not present in everyone. Now, sometimes we do see these outbreaks of things, and the last one we saw was in Leroy, New York. But these come up once in a while, where people all of a sudden there's an outbreak of ticks or an outbreak of some new pandemic of something, and people start to have these movements. And in almost all cases, these turn out to be what are called psychogenic or conversion disorders. And what happens is that stress and anxiety and groups of closed people can sometimes end up with people mirroring movements and behaviors that other people have. But this certainly is not what happens in Tourette. We went on to Dr. Drew, and anybody who would listen to us with our medical advisory board, and John Mink looked at a number of these cases, and a lot of the really the smartest Tourette minds in the country, and what we can tell you with certainty is that Tourette is not contagious from person to person. It does run in families, but is not contagious like a contagious disease. And so you can tell all the parents to relax. You're not going to spread the Tourette. And if they're picking up things, maybe they had undiagnosed Tourette, themselves with tics, or maybe there's some sort of psychological interaction that will need to be addressed. So Melissa writes back in. We were talking about gaming earlier, and interestingly, we talked about we don't have the answer to gaming. Some people get better, some people get worse, and it could be the context of the games. But thanks, Melissa, for telling us that your teen sons actually, their tics subside while gaming. Full engagement. We see this in chess, by the way, in chess players who have terrible tics that can sit and be engaged for several hours on a chess game, and their tics capture. And so it's not universal, and we don't understand it. And certainly, it's a mysterious disease, and so it's something that we really want to pay attention to. Jason's asking us, do we know anything about hypnotherapy for Tourette? And the thoughts, there's no major studies, Jason. I wish there were. It is pretty interesting. Hypnosis is a form of relaxation, though. And so the foundation house funded a number of proposals, and there's a number of studies from other groups too around the world about being mindful, about reducing anxiety, reducing stress. And so it's every indication that therapies like hypnotherapy that will relax could have the potential, but we don't really have the data on that. So we'll have to leave you with that hanging a little bit. And so sorry about that. I wish I could give you a little more information. So Nicole writes in, Nicole Service writes in, do you see parents and adults being diagnosed with TS after they have a child that gets diagnosed? Absolutely. My favorite story is it replays, like it's like Groundhog Day, like replays in the Tourette clinic over and over and over again with different families. You come in and you diagnose the child and you say, does anybody in the family have Tourette? No way, nobody has Tourette. You start telling them about the symptoms of Tourette. Are you sure? Grandpa, uncle, Bob, aunt, Judy, whatever. Did they have, sniffing? Did they sniff a lot? Did they throat clear a lot? Did they have funny things? Were they blinking their eyes funny? No. And then the family goes home, talks about it on their own, and then they come back. And a lot of times one of the parents will come back and say, I actually think I have Tourette, and they'll give you a very good story. And they went undiagnosed. And this gets back to one of the foundation's major goals, which is to decrease that latency. And all those people that are suffering from tics to decrease the amount of time it takes to diagnose. These people shouldn't be going through their lives and suffering and hiding it. And so I've heard stories of parents coming back, Jessica, just like what you're describing, or I'm sorry, Nicole. I'm seeing people come back, and Nicole, they come back and they are telling me, I would go into the bathroom during dates, and have to just, like I'd be holding all my tics in and I have to let all these tics out. I didn't realize it was tics during the stress and anxiety of dating. And so we hear many stories like this. So thank you for that question. Jessica writes in, I try to suppress my tics long enough to step out of the room when it flares up. Mine are violent and I'm ashamed of them. And so, Jessica, I'm really sorry. And certainly if you have violent tics, please give us a shout out at support@tourette.org. Let's make sure you're hooked with the Center of Excellence. Let's make sure, if any, we can, maybe help you with cognitive behavioral therapy through telemedicine. If you don't have something locally, maybe we can help you with medicines. Maybe we can help you with surgery, although surgery is in a minority, less than 5% of cases with severe Tourette. But, I hate to hear those stories. And so there's help there. And so hopefully there's something. And Kimberly writes back in, I never realized my dad had tics until my daughter was diagnosed. And so, again, this is just one of those stories that really, keeps playing out. So thank you, for writing in. And there's a tremendous here discussion on this from many of you throughout the world talking about this. There's a question from Nancy Hernandez about environmental toxins and exposures to persons with Tourette and uranium and benzene and other levels. Very few studies, but this is sort of an area that we really need to get more into. And the reason is that since the 1800s, there's been industrialization, and industrialization has changed probably the epidemiology of neurodegenerative and maybe neurodevelopmental diseases. So in the book that came out on March 17th, Ending Parkinson's Disease, there's a whole bunch of discussions about how industrialization affected Parkinson's disease. We're not as far down the road with Tourette. And in fact, Tourette, they say Parkinson's disease, if we're going to get to ending it, so that book is called Ending Parkinson's Disease, we need to increase National Institutes of Health funding by 10 times to get to the level of where HIV is. It's going to be a very important aspect to how we're going to move the needle forward. Tourette is just a small percentage of what Parkinson gets. So for us to start to move down the road, there's a whole bunch of studies that need to be done. And Nancy, one of those studies is environment and how environment may affect the tics. And so it's certainly really super important. And so Kim writes back, my daughter did see Dr. Mink and didn't mean to say they were contagious. Don't worry, Kim. We're all friends here on here, and I just want to make sure that we get the word out. I thought your question was awesome. And so with that, as we close down our hour here, and we're getting now down to the end of the hour, I want to say a couple of things to everybody. One, we're here to help. Okay, so the Tourette Association of America is here to help. This is the coronavirus. It's an unprecedented pandemic. It's nothing like what any of us have ever seen. The last major pandemic was in 1918, the flu pandemic, and this is really something. And I know you all are stuck at home and you're isolated, and we're worried about you. We're worried about like how this might affect your Tourette and your tics. So I want you to know that the Tourette Association of America has resources for you. Okay, there's a phone number 888, the number 4 Tourette, but it's a shortened Tourette because we run out of numbers or letters. 888-4-TOURET, 888-4-TOURET. There's also a COVID page set up at the Tourette Association of America. It's called tourette.org/COVID, tourette.org/COVID, or if you go to the Tourette Association of America by using your web browser and typing in Tourette Association of America, you will see all sorts of information. The deep brain stimulation information from that question that I mentioned is up at parkinson.org/corona. Okay, parkinson.org/corona. And we'll work with the Tourette Association of America to get some links over onto the Tourette site. But it applies to everyone. And there's recommendations out in the Journal of Parkinson's Disease about what to do if you have a deep brain stimulation device. And don't feel alone. So remember, you can take walks. There's ways to protect yourself. Remember, there's all sorts of new protective gear that's going to be out there. If the masks are bothering your face, I think is a great question. Make sure that you're asking the Tourette Association of America and your docs about all those questions that come up, because everybody's going to come up with the next, cure, ibuprofen, hydroxychloroquine. You need to make sure you understand that before you expose yourself to those risks. It is a respiratory virus. It is person to person. Wash your hands, sing happy birthday twice, every time you wash your hands, keep your hands away from your mouth, and try to socially distance as much as you can. And we know it's tough times, and we know that tough times can make Tourette worse. And for those of you that ask questions today, we'll try to provide the first 10 of you with the free copy of the book that came from the Tourette Association of America's Center of Excellence, the Tourette Syndrome, 10 Secrets to a Happier Life. It's also up on Amazon as well. And we'll ship those to the Tourette Association of America. So make sure that in the chat box, if you asked a question, that you write to us or write at support@tourette.org with your address, so we can ship you one of these books. We'll be happy to do that. And so I will just say I'm very optimistic that we're together one day at a time, that we will get through this pandemic, this unprecedented crisis. And I really thank you for spending the hour with us. This has been really fun. And all your questions from all over the world have been just delightful. And so please stay safe. Use all of our resources at Tourette Association of America, and let us know how we can help. So have a wonderful day.